Mckenzie Lumbar Spine Repeated Side Glides. This is a good exercise for a lateral derangement or a lateral disc prolapse in the lumbar spine. This type of problem can cause lower back pain and buttock pain. If the prolapse is severe, then the pain can go all the way down your leg or legs. Commonly you can get what is called a lateral shift, which is when you shift your shoulders to one side, creating a side-to-side curvature of the spine. It comes from the Mckenzie assessment and treatment philosophy. Undertaking this exercise, you need to have been assessed by a physiotherapist who is Mckenzie trained, as doing this exercise for the wrong problem can make things worse. This exercise is all about post-exercise symptom relief and what is known as centralization, which is when the symptoms move away from the periphery and closer to the midline of the lower back. If your symptoms increase more peripherally after performing this exercise, then you must immediately cease the exercise and consult your physiotherapist. Also, if you have cauda equina symptoms, which include bladder and bowel incontinence, retention, urgency and saddle area numbness, then this exercise isn't right for you and you need to see your physio or doctor as soon as possible. If you're unsure, then don't perform the exercise until you've seen your physio or doctor. Standing with your arm out to the side with your elbow bent to 90 degrees on the non-problem side, rest your forearm against the wall. Next, move your hips toward the wall as far as you can and then relax out of this position. Perform 10 repetitions as far as you can on each rep. It can bring on worse symptoms during, as long as afterwards the symptoms either lessen or centralize. The frequency that you should do depends on whether your symptoms are above the knee or below the knee. For above the knee, you should do 10 reps every 2 to 3 hours. For below the knee, you should do 10 reps every hour. When your symptoms move to the midline of your back, then you may need to change the exercise to a Mckenzie repeated extension in line, but you should consult your physio before doing this. Remember, this video is more of a technique guide, so make sure that you've been assessed and recommended this exercise first.